Hi, my name's Ava. I heard you have some questions about breastfeeding and the process of it. So I just came to talk to you about that. So it is important to note that the changes in your breasts and nipples are normal during this time. They might grow in size. So to accommodate this, it is important to wear a well-fitting bra that has some good support during the day and night. This might help alleviate some of the discomfort. It is normal for your breasts to leak for the first few weeks after the baby is delivered, and you can wear some breast pads to help with that leaking until it stops. If your breasts are sore, you're having any discomfort, you can also apply ice packs to help alleviate some of that pain.
So do you have any tips?
Yes, so you'll want to make sure that the baby is properly latched onto the areola, not the nipple. So the mouth should form a tight seal, and if you have any pain within the first, after the first few minutes, the pain is not normal. So if you were to have pain, that could indicate an incorrect latch. So how you would take the baby off the breast is you could use your finger and then just kind of go in the baby's mouth, separate it between the mouth and the breast, and that's a way that you can safely remove the baby off the breast. So you shouldn't feel any pain, and if you do, use that method to remove the baby off the breast and then reposition and then try again.
Okay. And about how often should the baby be breastfed?
The baby should be breastfed about 8 to 10 times per day, and you can go as long as the baby's hungry. So usually that's about 10 to 30 minutes. It is important during each feeding to breastfeed from both breasts. You'll want to keep the infant nice and close to your body. And then some good signs while breastfeeding are hearing the baby swallow but not click. You shouldn't hear a clicking noise. You also maybe will see some movement above the infant's ears. Maybe their little ears will wiggle. And then also you should not see any dimples in the baby's cheeks while breastfeeding. And then whenever you're done breastfeeding, it's important to burp them, so you can prop the baby up on your shoulder and gently rub or pat the baby's back to promote burping.
Okay.
Okay, so I'm just gonna talk about some care if you are not planning on breastfeeding. So for the first 3 to 4 days after delivery, you're gonna wanna wear a very supportive bra. You're gonna try to refrain from stimulating the nipples. You do not want to breast pump or let the baby suckle. That will just promote more milk to being formed. You can every hour apply cold ice packs to your breasts, but you do not want to put the ice pack directly on the skin, as it can cause tissue damage. So you could put a barrier in between, like a paper towel or a rag. And then you do not want to massage your breasts, again, trying to refrain from stimulating them, and then do not apply heat.
Gotcha.
So now I'm just going to talk about some sleep safety for the baby. You will want to make sure you have a safety approved crib to use. So the baby should sleep on its back, and it should sleep on a firm mattress with a fitted sheet. So there shouldn't be any blankets, no toys or pillows or small objects. Nothing else should be in the bed. You can have your baby go to sleep in like a sleeper onesie to make sure that it's kept warm, but no blankets or anything like that. The baby should sleep in the same room as you, as the parents, but it's very important to make sure that the baby does not sleep in the same bed as mom and dad.
Gotcha.
So now I'm just going to talk about a few other safety points for caring for your infant. So it's definitely important you want to wash your hands and practice good hand hygiene anytime before handling or picking up the infant. Sometimes it's important to have a bulb syringe on hand in case you ever need to get rid of any secretions in the throat or nose area, maybe like some mucus. And then it's really important after each use that you clean it in some warm soapy water after, and then make sure it dries completely before using it again so that bacteria is not growing in the syringe. It is required by law for infants to be placed in a safety car seat while the car is in motion. It should be rear facing in the back seat according to your state laws. And then it is important not to use any outdoor announcements, kind of saying that you just had a baby. This just can draw some unnecessary and undesired attention that you have a new infant in the home, and you should definitely question anybody inquiring about your infant in the hospital or whenever you come home.
Okay.
So now I'm just going to talk about a few different behaviors that you might encounter with your new baby, like crying, sleep patterns, and calming techniques. So a few different reasons your baby could cry is because maybe they're hungry, they need their diaper changed, or maybe they need to burp. It's important to burp them after each feeding. So some calming techniques are to change your baby's diaper, feed the baby. You can rub the baby's back or tummy. Skin to skin contact is a good calming technique. Even maybe holding your baby while walking, rocking the baby, things like that. If you ever do get frustrated or angry with the crying, you can put the baby in a safe place and then call a friend or family member and ask for help. So during this age, your infant requires a lot of sleep, but it is important to wake the baby up at least every 3 to 4 hours for feeding time. It's also important to have supervised tummy time where the baby lays on its stomach, and that will help with strengthening those neck and abdomen core muscles. Okay, so I see that you're planning on formula feeding the baby. So after the first few days of life, the baby will eat about 2 to 3 ounces per feed, and you'll want to feed the baby every 3 to 4 hours. If they happen to be sleeping longer than that, like longer than 4 to 5 hours, you'll want to wake the baby up to feed. So whenever you're formula feeding the baby, you want to make sure you hold the baby nice and close to you and kind of cuddle the baby. You'll want to hold the bottle with your hands. You'll never want to have it propped up with something. And then after the baby eats half of an ounce, you'll want to burp the baby by propping the baby up on your shoulders and gently rubbing or patting its back to promote burping.
Okay.
So some common things you'll maybe see in your newborn are a newborn rash, milia, and jaundice. So newborn rash are little red spots on your baby that have a white head. We also call it baby acne sometimes. It is important not to pick it. It'll resolve on its own. It's not concerning. And then avoid lotions, powders, and scented perfumes. Milia are little white bumps on your baby's face. You might have them around their nose or their cheeks. These are also not concerning. They will resolve on their own, usually within the first week of life. And then lastly, your baby may also have some jaundice or some yellowing color. This is normal in the beginning. So the baby usually will be turning a little yellow. It'll start from the head and then go down to the toes. But if your baby starts to get more yellow or more jaundice after the first 24 hours, after the birth, then you'll want to contact your healthcare provider immediately.
Okay.
So you'll want to give your baby a sponge bath until the umbilical cord has fallen off, which usually takes about 2 weeks. So you'll use warm water and a washcloth and give your baby a sponge bath from head to toe, and then do the diaper area last. If the umbilical cord gets soiled, you'll want to use some warm water and some soap and a washcloth to clean it up, and then you'll want to inspect it frequently, the umbilical cord and the skin surrounding, looking for any discoloration or discharge. And if you see any of those things, you'll report them to your pediatrician immediately. So in the beginning, you might want to keep a record of your baby's wet and dirty diapers to make sure they have adequate hydration and elimination. So during the first couple of days, you should have at least 2 wet diapers. On day 3 to 4, you should have at least 3 wet diapers and 3 fecal diapers. And then after that, you should have at least 6 to 8 wet diapers of pale urine per day. You might notice that your baby's bowel movements will go from a yellow-green coloring to a mustard yellow and get softer in consistency. Your baby should at least have 1 bowel movement a day, but it should increase with each day of life up until about 6 days.
Okay.
So when cleaning your baby girl, you'll want to make sure that you always wipe from front to back. Make sure that you clean in all of the creases and folds, and then you'll want to pat dry and then put a diaper on. We want to make sure we clean really good to prevent diaper rashes. And it may be normal for your baby girl to have some white or pinkish discharge. These secretions are normal and then will eventually stop. So regardless of if your baby boy is circumcised or uncircumcised, it is important to always wipe your baby from front to back, making sure to clean in between any folds or creases to prevent diaper rash. And then after that, you'll want to pat dry your baby and then put the diaper on. If your baby boy is circumcised, you will use a Vaseline gauze that will be changed each time you change the baby's diaper for the first 24 hours. It is totally normal for the head of the penis to be a red color, and then that will eventually change to have a yellowish film around the penis. And then to clean the area, you will use a soft cloth and some water. You will see a plastic ring around the penis. This is a common method of circumcision, and the ring will typically fall off within about 2 weeks. If you see any green colored drainage or bright red coloring around the circumcision or on the penis, you'll want to report that to your pediatrician immediately. Okay, so you would dress your baby similar to how you would dress yourself. You want to make sure that you're not overheating the baby with too much clothing or blankets. It is recommended that infants require all recommended vaccinations. And then if you feel like you ever want to hurt your baby, you should call 911 immediately. Okay, so now I'm gonna go over some reasons that you would call your pediatrician for if you see these concerning warning signs. So if your baby's abdomen is really firm and swollen, even when the baby's calm and relaxed, if your baby has a fever higher than 100.4, if you notice your baby's lips and mouth are blue and they're starting to breathe a lot faster, if your baby has some jaundice, a yellowing coloring or rash, if your baby is not as hungry and is not eating, if your baby is crying a lot more than usual, if your baby is coughing during the day and maybe even choking with some feedings, and then if you have any other questions or concerns in general, you can give your pediatrician a call.
Okay.